Depletion. Because of the relatively short period, 6.5 years, and low number of patients, 1,000 at our disposal so far, we cannot present direct data as to prevention. However, on the basis of results achieved during the past years, we are able to draw certain consequences as to the best and most economical possible pattern of application for using DD water as a means of prevention. Based on our results, we might suppose that DD water causes the destruction of potential tumors below the level of demonstrability if such an effect is unanimous in the case of tumors of a size belonging to the range possible to follow. Thus, DD water might be a harmless means of prevention as opposed to when healthy women belonging to a high-risk factor group for breast cancer are offered cytostatic drugs. This could make it possible for us to interfere with the multi-level process demonstrated in Figure 1.6 not only in its last phase but also at a much earlier stage. According to our present knowledge, the continuous consumption of DD water for prevention is not needed. It is enough to drink it as a preventive cure for 1 to 2 months a year. Our recommendation is to drink 0.5–0.7 liters of 105 ppm DD water for 2 to 3 weeks, then 1 to 1.1 liters for a further 2 to 3 weeks, followed by 0.5–0.7 liters for a final 2 to 3 weeks, Table 11.20. Regarding DD water consumption, the whole of the population can be divided into 2 main groups. To the first belong the healthy group H, and to the second those in whom some tumorous disease has already been diagnosed, group C cancer. The protocol of application for group H is given below. The rest is dealt with in detail in the section for physicians. Group H. To this group belongs the majority of the population. That is, people who are not even suspected of having tumorous diseases. If we look at the age grouping of cancer mortalities, Figure 1.3, it becomes clear that the number of cancer incidences begins to increase after the age of 40. Taking prevention other aspects into consideration, we have made further subgroups within Group H. HI, the population under 40, belonging to a low-risk factor group, with no hereditary predisposition background. This group has the lowest cancer incidence. People who live in unpolluted areas, do not smoke, consume healthy food, are not exposed to carcinogenic materials at their workplaces, and have no family history of cancer, belong to this group. For them it is sufficient to repeat the protocol once every 3 to 4 years. HII people under 40 who belong in one or more respect to a higher risk factor group. This group includes those who live in polluted industrial areas, and by their way of life smoking, alcohol consumption, and inappropriate nutrition increase the probability of tumor growth, or even if these factors are not present, the genetic predisposition for tumor growth is demonstrable. For them, a DD water protocol every 2 to 3 years is recommended. HII, the population above 40, regardless of whether they belong to a low or high-risk factor group. Those in this group should repeat the protocol once every 1 to 1.5 years. When determining the recommended daily dosage, we took a patient with an average weight of 55 to 70 kilograms, 122 to 155 pounds. In case of a greater weight, the dose should be increased proportionally. The daily dose of 0.5–0.7 liters was considered to be half of the average daily water consumption. Note: mixed with normal water in a 50–50% ratio. From 105 ppm DD water, a drinking water of 127.5 ppm can be obtained. The protocol can also be achieved by drinking a daily 1 to 1.4 L of DD water, which, in the first and last 2 to 3 weeks of the protocol, is produced by a double thinning of 105 ppm DD water. Chapter 2. To the patient. Introduction. It is important to stress right at the beginning that DD water is not a wonder drug, but it can be stated with great certainty that deuterium depletion may open a new era in tumor therapy. This is not merely because of the efficacy of the procedure, but because of the revolutionarily new therapeutic principle by which we approach treatment, and because a great therapeutic advantage can be obtained with minimal risk. We estimate that with the cooperation of specialists in question, the cancer mortality rate could, within 2 to 3 years, be decreased by up to 20 to 30% with intense research and further clinical trials. This ratio could be even further improved. We know dial tumor patients are in a very difficult situation for several reasons. Apart from suffering from the symptoms of the disease, a number of circumstances further aggravate living with the disease. The feeling of helplessness, fear, and ambiguity. The lack of information regarding treatment. The sometimes exhausting waiting before and during medical examinations. An enhanced emotional load before tests. The frequency experienced lack of compassion. The concomitant material burdens. The primary aim of this book is to make people aware of the fact that they can and should do a lot in order to avoid cancer from the intracellular processes. However, it also becomes clear that it is only possible to decrease probability there will always be tumor patients. Thus, the challenge to treat them at the highest level possible will always be present in society. With the information on deuterium depletion, we not only intend to present a new procedure to prevent cancer, to decrease its incidence, and to electively treat it, we also wish to reach an even more complex goal, namely that society unites to solve the problems of cancer. Everyone should be aware that a lot can be done to defeat cancer and that it is absolutely necessary to do so. For those, however, who have already been diagnosed with the disease, high-quality, humane medical care should be ensured in which the most effective treatment is available to everyone. This chapter was written primarily for those who have already been diagnosed with the disease. We have summed up for them the information we consider to be of utmost importance, hoping they find it useful. With the spirit of our book and the new procedure, we can contribute to the defeat of cancer. Important aspects in achieving our goal. By using deuterium-depleted water, we wish to achieve a simple goal: the need to decrease the amount of deuterium in the body. This can be achieved with the consumption of DD water because it behaves with the water content of the body, thus lowering the D concentration of the body. If this process is repeated daily, the D concentration of the body will continuously decrease, and this might result in the destruction of tumor cells. To achieve this, a dosage of optimal concentration and quantity is necessary. Appropriate dosage. A decrease in the concentration is determined by two main factors. The lower the D concentration of the water and B, the smaller the water volume it is mixed with, the greater the decrease in the concentration on consumption of a volume unit of DD water. To achieve the aim of the treatment, the following should be kept in mind. The patient should get a product of an appropriate D concentration. B, the daily amount should reach the necessary level. C, the effect of DD water should not be spoiled by consuming great amounts of water of a normal D content. The decrease in the concentration will not result in the desired effect. The patient consumes DD water of a concentration higher than needed, or if besides DD water, he consumes normal beverages, water, soft drinks, tea, milk, beer, wine in excessive amounts. Besides the recommended amount of DD water, the patient can, of course, consume a serving of soup made with normal water, or eat vegetables and fruit, but the consumption of considerable amounts of normal water is not recommended. To avoid diluting the D concentration at meals, when drinking water or when eating fruit, we recommend the intake of 0.51 dl undiluted DD water of a 25 ppm D content during meals. Daily dosage. We recommend consuming the necessary daily dose in 1.52 dl portions. It is good to begin the day with a glass of DD water and drink the rest during the day at equal intervals. The last portion should be consumed just before going to bed. We also recommend that DD water consumption precede meals by 10 to 15 minutes, and during meals 0.51 dl of undiluted 25 ppm DD water should be taken in addition to the daily amount. Nutritional aspects. According to our observations, DD water is less effective if the patient follows a strict vegetarian diet. From among meat products, we recommend the consumption of white meats, poultry, fish. Yogurt is the most favorable dairy product. As for fruits, the kinds grown in temperate climates are preferred to tropical ones. Figure 1.8 shows that nearing the equator, the D concentration of the precipitation is higher, and this has an influence on the D content of fruit grown in that region. This, of course, does not mean that the patient is not allowed to eat a banana or an orange occasionally, but their daily intake should be limited. Mention must be made of the fact that the D concentration of fruit concentrates may be higher than that of natural drinking water. We do not think that for the majority of people this is significant, but for patients with whom we wish to achieve a defined daily decrease in D concentration, the D content of other food besides DD water is not relevant. Any product which contains deuterium in a greater concentration diminishes the effect of DD water. We therefore recommend limiting their consumption or to totally abstaining from them. Can DD water be boiled? Deuterium-depleted water is bottled enriched with carbon dioxide. This might be disturbing for the patient, especially those with tumors of the oral cavity or those of the stomach. To avoid unpleasant effects, DD water can be boiled to make tea or soup. Boiling in itself does not change the compound or efficacy of the product. It is nevertheless recommended that patients boil DD water for a minimum amount of time only, and under lid to avoid it getting in direct contact with air or moisture. What other SUPPLEMENTARY treatments are recommended? Patients and their families are in a very difficult situation when they want to find their way in the maze of possible alternative medications and treatments. There are many approaches, several treatments and cures available, and it is hard to decide which one to try. The best is not to amass various treatments and not to erratically use one drug after the other, but to choose 2 or 3 convincing procedures. Another issue of importance is how persistently these treatments are followed. Errors can be made in both ways. One mistake is that even when the ineffectiveness of some product has already been proven, the patient nevertheless sticks to the given treatment. The other is when the treatment is stopped too early, when it cannot as yet be expected to show a positive effect. There is no absolute truth concerning these questions. Therefore, it cannot be said that one procedure should be continued this long and the other that long. It is important, however, to choose a procedure with due circumspection and to apply it consistently within the limits of rationality. Many patients have tried the so-called Beers drops along with DD water and the drugs Q-Levitt and, later, Avemer. It is impossible to tell which product played a role, and if so, to what extent, in the improvement of a patient. It is also difficult to determine what would have happened had he applied only one or the other. What can be justified on the basis of observations is that the products have reinforced rather than weakened each other's effect. We consider it a guiding principle that DD water should be applied alongside conventional treatment. The effects of DD water consumption. DD water has, for the last years, been consumed primarily by tumor patients and only by a few who had no detectable tumors. It can be stated in general that, in the latter, the consumption of DD water had no perceivably expressed effect. Cancer patients, however, did experience effects from DD water. Just as an inflamed tooth has its symptoms when tumor cells start to decline massively, this, naturally, also has certain signs. Symptoms experienced by tumor patients can be explained by the interaction of DD water and the tumor, as a result of which an inflammatory process takes place in the tumor and its surroundings. On the basis of observations, accounts, and tests, it can be stated that the accompanying symptoms are the consequences of the DD water tumor interaction. There are generally observed and differing phenomena in various tumors. All of these can be attributed to the differences in sensitivity, localization, and size of various tumors, as well as to dosage and a number of other factors. The most frequently observed accompanying phenomena: general weakness, despondency, drowsiness. These accompanying symptoms were experienced by most patients. They generally appeared a few weeks after starting DD water consumption and lasted for various periods. It is important to note that when the close is increased, despondency and drowsiness appear again. If these symptoms disappear and the tumor is still present, the dose must be increased further. Symptoms do not appear if the size of the tumor is small, 1 to 2 cm in diameter, as this does not perceivably burden the patient. The phenomenon was observed in the case of tumorous cats and dogs which had been lying or sleeping for weeks. Weakness and drowsiness are attributed to the necrosis of tumor mass and the reactions connected with it. Flush. Occasional high temperature or sudden attacks of fever were experienced in an advanced state and in the case of a large tumor mass. It is a known fact that having reached a certain size, the tumor, in some cases, undergoes spontaneous necrosis, which, in a late phase of the disease, is accompanied by occasional high temperature. The phenomenon was observed during the application of DD water and could be attributed to necrosis affecting a greater mass of cells. Flushing of the face or local skin blush were frequently observed. Temporary increase of pain. The beginning of DD water consumption does not automatically and immediately result in the subjective well-being of patients. The body has to subdue the aggressive growth of the tumors. Unfortunately, as the consequence of treatment, there might be a temporary increase in pain as well. This usually occurs in the case of bone metastasis and, to a lesser degree, with tumors of the viscera. We advise patients to consult their doctors and to bridge this period with the help of prescribed painkillers. Alleviation and cessation of pain. It is difficult to foretell whether the alleviation or cessation of pain in a given patient is preceded by the increase of pain, but alleviation or cessation of pain is one of the surest signs of improvement. The cessation of pain is explained by the improvement of the original disease, swelling, and softened IG of the tumor area. In the case of tumors near the skin surface, the size of the tumor often increased but also became softer. Continuation of the treatment in a certain time resulted in a considerable regression decrease in size of the tumor. The temporary growth might be due to inflammatory reactions accompanying DD water consumption. Warming of the tumor area. Patients on several occasions experienced that tumors dosed to skin surfaces become noticeably warmer. This observation correlates with former observations. In such cases, the cooling of tumors is recommended, as this might enhance the effect of DD water. Tingling. Crawly feeling inside the tumor. These feelings are also accompanying phenomena of processes occurring in the tumor. Bleeding. In the case of tumors of the bladder and rectum, the location of the tumor determines the consequences of tumor necrosis. In the case of the two above tumors, it frequently happens that necrotic pieces of tissue become detached from the tumor and leave the body, accompanied by minor bleeding. Increase of appetite and strength following an initial and transitory worsening. Up to 50 to 60% of the patients felt better physically. Their appetite grew and their strength improved. Weight gain. Besides the above changes, patients often experienced weight gain. In some cases, several out of 1,000, the weight gain happened very quickly and reached up to 15 to 20 kilograms, 30 to 110 pounds. In our view, this was possible not only through the positive effect exerted on the basic disease, but also because of other physiological changes evoked by DD water and connected to the secondary effect excited on the thyroid gland. Stomach complaints. Having consumed DD water for a longer time, some patients complain of stomach problems. In such cases, we advise them not to drink DD water in its carbonated form, but make tea with it. This usually was enough to eliminate the problem. While healing after a strong discharge with open, ulcerous tumors. In the case of ulcerous tumors, following the consumption of DD water, a strong discharge appears. This can be interpreted as a positive sign because in certain cases, in place of the one-time tumor, a crater remains, which gradually closes. Improvement of the general condition. Some weeks or months after beginning the consumption of DD water, patients feel better and their stamina improves. Brick powder in the urine. In several cases, a brick powder-like material of reddish or rusty color appeared in the urine, which could be attributed to the necrosing mass of tumor. It is advisable to consult a doctor and test blood levels of uric acid. Decrease in side effects of radiation or cytostatic treatment beyond its effect on tumors. DD water also helps conventional therapy. Blood tests of patients consuming DD water did not worsen in the usual manner, and in some cases hair loss also stopped, even if it had previously been a concomitant of treatment, as did strong nausea. DD water consumption, but especially the use of skin ointment made with deuterium-depleted water, alleviated skin complaints that had appeared as a consequence of radiation therapy. A more severe cough in case of lung cancer. In the case of tumors of the lung, the effect of DD water manifests itself in the strengthening of the urge to cough. This, too, is in connection with the size and location of the regressive tumor area. Patients coughed up while sputum, mostly in the mornings, which, in some cases, was slimy and sticky. Following the cessation of the urge to cough, patients were able to breathe more easily as their lungs fill with more air. The mucus in some cases also showed hemorrhage threats. The basic rules of DD water supplements. 1. Having consulted the doctor, the patient should consume DD water in recommended quantities, together and in harmony with conventional treatment. The present legal situation and our current level of knowledge, for the time being, make the consumption of DD water possible only in conjunction with conventional treatments. As our knowledge widens, there surely will be cases when DD water can be used as an exclusive treatment. It is only then that we will know which cytostatic drugs help the effect of DD water and which can entirely be substituted by deuterium-depleted water. 2. An untimely interruption of DD water treatment is not recommended. This is the most important advice to follow. DD water displays its effect rather slowly, over the course of several weeks or months. If, after a cure of several months, the patient interrupts the consumption of DD water, he gives tumor cells a chance to restart dividing beyond control. If, in the course of conventional treatment, the patient cannot consume any liquid for several days or a longer time because of severe nausea, it is advisable to start consuming DD water only after having finished cytostatic treatment. It is advisable to continue DD water consumption after having reached total remission. The duration of the cure is difficult to determine, as we do not have adequate experience. In general, it is recommended to have a few months break after half to 1 year treatment. 3. The first break in the treatment should not last longer than 2 or 3 months. Whether the treatment resulted in total remission can only be stated with great certainty 5 to 6 years after completion. A patient cannot be considered cured even if he has been free of symptoms or complaints for several years. Thus, it cannot be excluded that when a patient stops drinking DD water, residual groups of tumor cells will start to grow again. Therefore, after the first break of a few months, we recommend a protocol of 4 to 6 months again. This can be followed by a longer break of 4 to 6 months to be continued with a protocol of 2 to 3 months. A detailed guide to the application of DD water is given in the section designated for physicians.